can rinse your hands thoroughly with clean tap water and dry your hands with a clean towel, electric hand dryer, or air dryer. Soap and friction are what help to lift the dirt, grease, and microbes, and that's why it's so important to wash your hands by following these steps: wet, lather, scrub, rinse, and dry, so you can stay healthy and keep those around you healthy. Next slide. Cleaning and disinfecting, as I've said, is very important. You'll want to wear disposable gloves to clean and disinfect. You'll want to routinely clean and disinfect high-touch surfaces, and high-touch surfaces include tables, doorknobs, light switches, countertops, handles, desk, phones, keyboards, toilets, faucets, sinks, etc. You'll want to clean the visible dirty surfaces using soap and water. And when you're disinfecting, you'll want to use EPA-registered household disinfectants. And we've provided a link here on this slide to those disinfectants. You can visit that website and find a list. You will want to make sure you follow the instructions on the label to ensure safe and effective use of the product. So just a moment here, we'll discuss using household bleach to disinfect surfaces. To do this, you mix 5 tablespoons or 1/3 cup of bleach per gallon of water. Or you can mix 4 teaspoons of bleach per quart of water. Let me say that again because I tripped over my words and I want to get it correct. 4 teaspoons of bleach per quart of water. You'll want to follow the manufacturer's instructions for proper application and ventilation. And you'll want to check to make sure the product hasn't passed its expiration date. You never want to mix household bleach with ammonia or any other cleaner. Unexpired domestic bleach will be effective against coronaviruses when properly diluted. Next slide. So we can talk a minute now about social distancing. This is keeping space between yourself and other people outside of your home, and this is essential to preventing the spread of the coronavirus. To practice social distancing, you'll want to stay at least 6 feet or 2 meters away from other people when outside of the home. You do not want to gather in groups. You want to avoid crowded places and mass gatherings, and do not hug, kiss, or shake hands. Another thing is to avoid close contact with people who have symptoms. And this public health measure is just very important and something you've probably been hearing a lot about. And we do know that social distancing is a challenge for many families who are sharing one space. It's even more crucial that these households follow safety guidance when trying to prevent the spread of coronavirus, and that includes hand washing, cleaning surfaces, etc. There is a web page on the CDC coronavirus or COVID-19 website that discusses guidance for those living in close quarters. Next slide. CDC recommends wearing cloth face coverings outside of the home to help prevent the spread of COVID-19. I'm sure you've been hearing about the use of cloth face coverings. You do not flavor that there's not all the information we want right now about the risk of COVID-19 in people with HIV. We know that those that don't have it control are probably more at risk, but we can't say that those with control, are not going to be at risk. So I think it's safe to really look at these categories and take the precautions needed if those risk factors are there. And in your patients and yourself, it's just very important to protect these populations. So I'm referring now to slide 23 with those who are immunocompromised. I'm just going to read the list one more time. This includes those undergoing cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, and poorly controlled HIV and AIDS. And then the use of any immune weakening medications. So it's a really, could be a lot of individuals. So it's just really important to focus on those people and not underestimate your risk.
There is a question here that it's making reference if we have other languages available for resources besides Spanish.
Yes, and I'm not sure the exact number of languages represented on our website, but we have a number of different resources. So please visit our communications and those resources and see if you can find what you need. And if you can't, please contact us and let us know what you need, and we'll communicate that.
Another question I have has to do with community health workers. Are they factored in the workforce development planning for coronavirus contact tracing teams?
Sure. So as mentioned before, there are a number of national initiatives as well as initiatives happening at the state or city level that are all considering the critical role that community health workers can play right now to enhance public health capacity specific to contact tracing. Contact tracing is an important aspect of the role of community health workers. One, because we have an ability to really build trust and to provide respectful services in a language and in a context that many communities that may be not difficult to reach, but may experience barriers to accessing the health system or information about infection, and CHWs are able to reach them. So yes, there are many initiatives that include a role for community health workers. The National Association of Community Health Workers, what we are doing is offering to people clarity on the role of community health workers, that we are effective to support contact tracing efforts, and that we are also effective to continue to provide all of the other services within our roles and our qualities and skills in this time of emergency response.
Thank you for that.
There is another question related, and this is, I guess, for you again, Denise. If you have any pearls of wisdom to share with them about how to best spread the preventive measures and messages in the Indian country, especially in rural areas.
Yeah, our rural communities have unique challenges. There are many community health workers who had their initial face-to-face or community-based services disrupted, and a lot of them transferred or transitioned those services to phone-based services, onto Zoom, onto different web platforms, or even telehealth. But for our rural communities, there are real barriers and there are real challenges for community health representatives or CHWs to connect with their communities. If you are still conducting home visits, one, I hope that you have support in your transportation. So if people are reimbursing you for the services that you're providing, I know many of you have to drive several miles to reach and connect with your clients. Please refer back to all of the safety precautions to conduct your home visits. Oftentimes, if people are coming into town or coming into to clinics to get tested, that may be an opportunity for you to share or distribute information so that you don't always have to travel to communities to conduct those home visits. This is really going to take a networking and a collaborative effort for all of us, but particularly for folks in rural communities. So for instance, if you are attempting to service elders and you know that perhaps there is a separate service one that you do not provide, that brings food to the home. Maybe you want to try and coordinate your education and your services with those services so that you're better able to get the services to the elders who need them, and folks don't have to make as many visits to the home, increasing the risk of infection for that vulnerable individual. At NACHW, we have representatives from the CHR community who we would love to make connections with you. They work across the country so that you can get specific answers on ways to innovate and coordinate services in your tribal nation.
Colleen, I believe that someone is asking regarding the probable cases. Can you expand on that a little bit more, specifically under the perspective of testing being available?
So the testing, probable cases, and kind of the suspected cases of COVID, and kind of erring on the side of caution when those are sick. That's kind of how we've been going about this, but testing is, picking up, and we will be able to confirm cases of COVID when testing is widely available in communities. But kind of in the meantime, as testing's been being stood up and tried to get it widely implemented in communities, we do need to take the necessary precautions around probable cases and around suspected cases, and really the guidance and the recommendations from CDC right now is erring on the side of caution with regard to symptoms and following these safety practices. And that's what you're seeing with our social distancing measures and all the messaging and recommendations right now.
Is it also a myth that people who suffer the flu are at high risk of testing false positive to the virus?
I have not heard that to be true, and I'll see if any others on the call have heard that. I don't think I've heard that. I would look on the website.
I haven't seen that in the Q&A on any place there.
No.
Thank you.
There is another question here for Denise, and that question is, are CHWs being given additional resources and training to learn how to conduct some visits through telehealth? This might help reach more clients in rural areas.
Yes, so I have certainly heard from community health workers and employers across the country that they are offering, for those who offer telehealth services and for those who can reach their clients that way, they are offering free trainings. There are also a number of different online platforms that are offering free software and free trainings as well. If you work with an employer, I'd reach out to that employer and see what is the approved platform for you to conduct telehealth services. But certainly there are a number, all of the kind of popular platforms, including the Google Hangout and Zoom, a number of them, Microsoft Teams, a number of them are offering free services and supports so that if you want to transition your telehealth services, you can better understand the benefits and kind of the functions of those tools.
On that very same thought, what are the thoughts about virtual home visits and maintaining patient client privacy?
Yeah, well, if you've already been providing services to those clients, that individual or family member, hopefully you already have the appropriate waivers or approvals or signatures to provide service. So let's assume that that person has been working with that client before. There are some security issues with using telehealth. We know that I've even had one of my Zoom meetings to be hacked. I don't know what the official term is, but someone just kind of jumped onto the meeting, and fortunately we were not addressing a HIPAA protected or a confidential issue at the time. This is why you really want to understand the platform that you're using and why you want to receive proper training about that. you need to get the approval from the patient, from the individual or family, to be able to communicate with them in that way. I know when I was providing services for people living with HIV/AIDS, we needed to get that individual's consent before we could make a phone call, before you can leave a voicemail, before you can, leave a note or notice in the mailbox. So please consider all of those privacy and protection protocols before you are rushing to implement telehealth. Even in your desire to want to reach clients, we have to protect their privacy.
There is another question here for you, Denise. Should community health workers continue with routine home visitation activities, or should home visit only be reserved for those patients more at risk or with serious conditions or needs?
Yeah. So if you have an employer and your employer is recommending or asking you to continue to conduct home visits, I would hope and would advocate for that employer to provide you with the appropriate personal protective equipment, as well as some of the safety precautions and protocols that Colleen mentioned before. So if you don't have training in universal precautions, if you do not have access to gloves, hand sanitizer, an appropriate cloth mask, if you are not able to conduct that home visit and maintain a social distance of 6 feet or more while you're conducting that visit, and if this is not a priority visit, if there is a way to conduct the same service in a no-touch or a low-touch fashion, I am advocating for your safety and for the safety of your peers, your coworkers, your family members, that you do all that you can to protect yourself and your clients. So work with your employer. Make sure that you understand and that you receive training, as we mentioned earlier, from a medical professional, so that you really understand how this novel coronavirus is transmitted and how it can infect you. Understand the risks of the clients that you may be serving. And if they're at high risk, do what you can to reduce that risk by practicing and applying all of those safety precautions.
Well, we're reaching the time to almost conclude our webinar today, but I want to give you, Colleen, the last question. And this one is, why is an N95 not recommended to wear during a home visit?
So these masks are being reserved for healthcare professionals right now. And so I'm not sure that we've provided at CDC any recommendations for home visits yet, but that is the guidance we have right now, is the N95 masks are recommended for healthcare professionals, but I think it's important to talk to your employer, and I would advise you to go to the CDC website and look at those pages for healthcare professionals and what's being recommended to protect yourself and protect others, and be knowledgeable of that and talk with your employer.
So we have reached 5:01 p.m. We should be concluding the webinar. Ladies, please go ahead and conclude the webinar for today. Thank you very much for being with us. Please conclude the webinar.
Thank you. It's been great, and these questions have all been helpful discussion, and it's been great to hear Denise as well.
Thank you, everyone. Thank you, Betsy and Colleen and all the team at CDC. And for everyone on the call, my prayers are with you and your family and your community during this time.
Slides and webinar are going to be available pretty soon. Stay tuned. Some of the questions that have been raised will not be forgotten. So stay tuned. We're going to be coming back to you all. Thank you very much.
Thank you.